Here is something your doctor may not have mentioned at your last appointment. I say that not to alarm you, but because I spent nearly 25 years watching this problem quietly destroy the quality of life for patients who had absolutely no idea it was happening to them. The burning in your feet at night, the numbness creeping up your legs, the feeling you are walking on sand when you are standing on hardwood floors. These are not signs of getting older. They are warning signs, and they point directly to a deficiency in a single vitamin your body desperately needs to keep your nerves alive and protected. That vitamin is B12. Today, I'm going to walk you through exactly what B12 does for your nerves, why so many people over 60 are running dangerously low without knowing it, and what you can do starting today to give your nervous system a real chance to recover. I want to give you a little context about who I am and why I care so much about this. I practiced internal medicine for over 2 decades. In that time, I saw thousands of patients, men and women in their 60s, 70s, 80s, who came to me with nerve pain, balance problems, cognitive fog, and exhaustion that their previous doctors had chalked up to aging. When we ran a complete panel, including B12 levels, a significant portion came back deficient or borderline, not low normal, deficient. What frustrated me most was this. Many of them had been symptomatic for years. The numbness had been building. The fatigue was masking something deeper, and the medication they had been taking, in many cases for years, was making the deficiency worse. That is what I want to help you understand today, not to scare you, to equip you. According to research published in the American Journal of Clinical Nutrition, approximately 1 in 5 adults over the age of 60 has B12 levels low enough to cause neurological symptoms. 1 in 5. After age 75, that number climbs closer to 40%. What genuinely concerns me as a physician is this. The symptoms of B12 deficiency are so common, so easy to dismiss, so closely mimicking what we call normal aging, that millions of Americans are living with nerve damage right now and have no idea the cause is sitting in their medicine cabinet, a medication they trust, a medication they need, but one that, without a compensating strategy, is quietly depleting the very vitamin their nervous system depends on. I want to tell you about a patient I will call Margaret. She was 68 years old, retired school teacher, sharp as a tack, active in her church community, and she came into my office complaining about 2 things. 1, she could not feel her toes clearly anymore. 2, she kept dropping things, cups, her phone. Her grandkids had started noticing. Her primary care physician had already diagnosed her with peripheral neuropathy and told her it was related to her type 2 diabetes, which she had managed for 11 years. That diagnosis was not wrong, but it was incomplete. What no one had checked was her B12 level. When I tested her, her B12 came back at 178 picograms per milliliter, clinically deficient. And when I reviewed her medication list, I found something important. She had been on Metformin. It's a first-line diabetes drug that is excellent at managing blood sugar for over a decade. What many patients are not told is that Metformin is well documented to block B12 absorption. The more years on Metformin, the more significant the depletion. Margaret's nerve damage was real. Her diabetes was real. But part of what was accelerating her neuropathy was a correctable, testable, treatable B12 deficiency that had gone undetected for years. We corrected it. We supplemented aggressively. Within 4 months, she told me the tingling at night had decreased meaningfully. She was dropping things less often. She said she felt more like herself. She did not get a miracle, but she got her quality of life back. And that is what I want for you. Let's start with the basics, because understanding what B12 does will make everything else in this video click into place. Every nerve in your body is surrounded by a protective coating called the myelin sheath. Think of it like the rubber insulation around an electrical wire. That insulation is what allows the electrical signal to travel cleanly from your brain to your hand, from your spinal cord to your foot. When that insulation breaks down, signals get distorted. They arrive late, they arrive scrambled, or they do not arrive at all. That is what you feel as tingling, burning, numbness, or weakness. The wire is still there, but the insulation has been stripped. Vitamin B12 is the critical building block your body uses to manufacture and maintain that myelin sheath. Without enough B12, your body cannot repair the insulation on your nerves. And because nerve damage is cumulative, the longer the deficiency goes uncorrected, the more damage accumulates. I want to challenge something patients hear constantly. Doctors often tell patients that neuropathy is permanent. And at very advanced stages, that can be true. But when the deficiency is caught and corrected before extensive nerve death has occurred, meaningful recovery is possible. A 2019 study in the journal Nutrients found that patients with B12-related neuropathy who received early supplementation showed measurable neurological improvement over a 6 to 12-month period. The key word there is early, which is why today matters. The action step here is simple. If you have any symptoms of neuropathy and you have never had a comprehensive B12 test, ask your doctor for one at your next appointment. Write it down. B12 with methylmalonic acid. That full panel will tell you far more than a standard B12 reading alone. This is the section I need you to pay close attention to because this is where the story gets personal for a lot of people watching. There are 3 categories of medications that are heavily documented to deplete B12 levels over time, and these are not obscure drugs. These are medications that tens of millions of Americans over 60 take every single day. First, Metformin. If you have type 2 diabetes and you take Metformin, your doctor should be checking your B12 annually. The American Diabetes Association now recommends this explicitly. Metformin interferes with the receptor in your small intestine that absorbs B12. The longer you take it, the more significant the cumulative loss. Studies in JAMA have shown that long-term metformin use can reduce B12 levels by 19% or more. Second, proton pump inhibitors, commonly known as Omeprazole, or Prilosec, Pantoprazole or Protonix, Esomeprazole or Nexium. These are the acid-suppressing medications prescribed for acid reflux and GERD, and they rank among the most commonly taken drugs in America. The mechanism is straightforward. B12 from food needs stomach acid to be released and absorbed. Suppress the acid and you suppress the absorption. A study published in JAMA Internal Medicine found that people taking PPIs for more than 2 years had a 65% higher risk of B12 deficiency. That number is worth sitting with. 65% higher risk. Third, H2 blockers including famotidine and the now recalled ranitidine. These work by a similar mechanism, reducing stomach acid, and while they are somewhat less potent than PPIs, long-term use carries the same depletion risk. Now, I am not telling you to stop any of these medications. That is a conversation for you and your physician, and many of these drugs are absolutely necessary. What I am telling you is that if you take any of these medications and you have symptoms of neuropathy, fatigue, cognitive sluggishness, or balance problems, the connection deserves to be investigated. The daily habit I recommend is straightforward. At every medication review, ask your doctor or pharmacist one question. Does anything on my list affect B12 absorption? That question alone could change your trajectory. Let me walk you through the symptom picture because B12 deficiency does not always look the way people expect. The classic picture is neurological. Tingling or numbness that starts in the feet and hands and moves inward. Balance problems, particularly in low light or on uneven ground. A feeling that your feet are wrapped in cotton or that the ground is not quite where it should be. Muscle weakness in your legs. Difficulty with fine motor tasks like buttoning a shirt or picking up small objects. But there is a second set of symptoms that people frequently attribute to aging or stress. Memory fog that feels different from forgetfulness, difficulty concentrating, irritability, or mood changes that came on gradually, a sense of mental fatigue even after rest. These cognitive symptoms happen because B12 is also essential for producing the neurotransmitters your brain uses to function. When B12 drops, your brain's chemistry drifts. Research published by the Cleveland Clinic has linked long-term B12 deficiency to accelerated cognitive decline in adults over 65. Now, something critically important about testing. Standard serum B12 tests measure total B12 in your bloodstream, but not all of that B12 is in a form your cells can actually use. You can have a borderline normal serum B12 and still be functionally deficient at the cellular level. The more complete picture comes from adding two markers, methylmalonic acid and homocysteine. When B12 is low at the cellular level, both of these compounds accumulate. They are like the backup indicators on your car dashboard when something is wrong under the hood. The serum B12 alone is like checking your gas gauge. MMA and homocysteine tell you whether the fuel is actually getting to the engine. This test is covered by most insurance plans when there is a documented clinical reason. Symptoms of peripheral neuropathy are sufficient justification. Write down these 3 words for your next appointment. Methylmalonic acid level. That is all you need to say. If you have already tried a B12 supplement and noticed little difference, this section may explain why. B12 comes in several forms. The most common form in cheap supplements is cyanocobalamin. It is inexpensive, it is stable, and for people with healthy gut absorption, it works adequately. The problem is conversion. Cyanocobalamin requires your liver to convert it into the active form your cells can actually use. After 60, that conversion process becomes less efficient, and for people with certain genetic variants, a group that represents somewhere between 10 and 20% of the population, that conversion barely happens at all. The active forms of B12 are methylcobalamin and adenosylcobalamin. These are the forms your body uses directly without conversion. Research from the Journal of Nutritional Science and Vitaminology has shown that methylcobalamin in particular has a specific affinity for nerve tissue. It concentrates in the nervous system preferentially, which is exactly what you want when protecting against neuropathy. The practical action here is to read the label on any B12 supplement you buy. Look for methylcobalamin or hydroxycobalamin in the ingredient list. If it says cyanocobalamin only, it may be worth switching, particularly if you are over 70 or have documented absorption issues. Dosing is a conversation with your physician. But research published in Nutrients suggests that oral doses of 1,000 to 2,000 micrograms daily of methylcobalamin can raise blood levels meaningfully, even in people with moderate absorption problems. And for those with documented severe deficiency or confirmed absorption failure, B12 injections bypass the gut entirely and deliver the vitamin directly into the bloodstream. This is the most reliable route when the gut cannot be trusted to do the job. Before I continue, I want to pause for a moment and invite you to do something. If you are watching this and any of what I have described sounds familiar, whether that is the tingling, the medications, the missed testing, scroll down and leave a comment below. Tell me what symptom first made you take notice, or tell me what medication you are on and when you last had your B12 tested. I read these comments, and more importantly, your experience might help someone else watching this video who is quietly sitting with the same question and has not yet made the call to their doctor. Sharing your story here is a small action with a potentially large impact on someone's life. Here is something that often surprises people. B12 does not operate in isolation inside your body. It works closely with 2 other nutrients, and if those nutrients are also low, you will not get the full neuroprotective benefit even if your B12 levels are adequate. The first is folate, also called B9. B12 and folate work together in a biochemical pathway called the methylation cycle, which your body uses for nerve repair, DNA synthesis, and neurotransmitter production. When one is low, the other cannot do its job effectively. The CDC recommends at least 400 micrograms of folate daily for adults. Food sources include leafy greens, legumes, and avocado. The supplement form to look for is methylfolate rather than folic acid, for the same conversion reason I described with B12. The second is B6 pyridoxine. B6 supports myelin synthesis and is involved in serotonin and dopamine production. It is also one of the most commonly depleted vitamins in adults who take certain blood pressure medications, including loop diuretics. One important caution: B6 supplementation above 100 milligrams daily over extended periods can actually cause neuropathy in some individuals. So this is not a more is better situation. Amounts in the 25 to 50 milligram range under physician guidance are appropriate. Think of it this way: B12, B9, and B6 are like 3 legs of a stool. You can have one leg that is long and strong, but if the other two are short, the whole stool wobbles. Your nervous system needs all three balanced. The daily habit here is a food habit. Eat one leafy green daily. Spinach, kale, arugula, one egg, one serving of legumes 3 times per week. These foods deliver B vitamins in bioavailable forms that work synergistically. And if your diet is limited by preference or digestive tolerance, this is a conversation worth having with your physician about targeted supplementation. I want to end the content portion of this video on something you have complete control over, because B12 and testing and medication management are all important, but they happen in a clinical context. What happens in your home every day is where the real protection is built. First, daily walking, not running. Not a gym routine if that is not accessible to you. A 20-minute walk at a comfortable pace has been shown in research from the AHA to improve peripheral circulation, which is the blood supply to the nerves in your legs and feet. Nerves that are well perfused are more resilient. If neuropathy makes walking uncomfortable, start with 5 minutes and build slowly. Movement matters even in small doses. Second, blood sugar management, particularly after 60. Elevated blood glucose is directly toxic to nerve fibers. Even in people without a formal diabetes diagnosis, the zone called prediabetes, which the CDC estimates affects 1 in 3 American adults over 65, causes progressive nerve damage over years. Every time you choose a lower glycemic meal, you are directly reducing the inflammatory load on your nervous system. Third, sleep. This may be the most underappreciated lever of all. Your nervous system does its primary repair and regeneration work during deep sleep. Research published in Nature Neuroscience identified that glymphatic clearance, the brain's waste removal system, operates almost exclusively during sleep. When you chronically sleep fewer than 6 hours, nerve repair slows. If sleep is a problem for you, that is worth addressing directly and proactively. None of these are complicated. 1 walk, 1 dietary choice, 1 honest conversation with yourself about sleep. Stacked consistently over 90 days, these habits change your neurological baseline in ways that no supplement can replicate on its own. I want to say something to you directly before I close today. You are not too old to change this. That is not optimism. That is physiology. The nervous system retains what researchers call plasticity well into the 8th and 9th decade of life. The capacity for partial recovery from B12-related neuropathy is real, documented, and available to you if you act early enough. 5 steps. None of them require a prescription. All of them can begin this week. The tingling in your feet is your nervous system asking for help. The exhaustion that does not make sense is your body waving a flag. The cognitive fog that you have been blaming on stress may be something your next blood panel can explain and correct. You deserve answers. You deserve to feel steady on your feet, clear in your thinking, and confident in your body. That is not asking too much. That is asking for what your body is designed to give you when it has what it needs. I am here every week with information exactly like this. Not to alarm you, to arm you. If this video helped you understand something you had been wondering about, do something for me. Send it to one person in your life who is over 60 and takes medication for diabetes or acid reflux. Do not text them a link and say nothing. Send it with a message. I found something you should watch before your next doctor's appointment. That single action could change their trajectory. And if you want to see more videos like this on medication safety, nerve health, and what your lab results actually mean in plain English, subscribe to this channel. I put out new information every week, and I make it my job to make sure you understand your own health as well as your doctor does. I will see you in the next one.